Okay. Okay, good afternoon, students, once again. So we will be starting your anatomy class. Okay. Now we will be having your anatomy theory class. So in the first unit, you have got basic of bones and joint. Okay. So in the basic of bones and joint, what we will get, we will study about bones. Okay, we will study about the bones and joint. So before starting it, I'll just ask you one question. You just imagine your body without bones, without skeleton, how it will look like. Anyone? Without bones, how your body will look like. You just imagine how it will look like. Anyone?
Snack.
Snake?
Actually,
Yeah. It will be just like jelly, like no, means nothing. You won't have anything. Just like will be like what to say, rubber. No, will be just like that, without any structure. Just imagine you won't have any structure. You will be
like
shapeless.
frog.
Without any shape, you will be shapeless. So in this unit, we will study about bones. Okay. So first, let me introduce about bones. These bones, what do? They support. Okay, they will support and protect your body. Understand? The bones, they will support and protect your body. Understand? And whatever organs you are having, like internal organs like what? Your brain, your liver, your kidney, all this like they support, so that it will come in shape, so that it will be in the place. Okay, these bones they help and they for supporting and for protecting the body. Understand? Are you clear with point number one? This one? Are you clear?
Yes, ma'am.
Okay. Next is they also produce various blood cells, store minerals, and provide support for mobility in conjunction with muscle. Means what? They will provide these bones. No, yeah. These bones they will produce blood cells, and they will store minerals also. And what will they do? They support for mobility. Mobility in conjunction with muscles means what? Mobility means moving from this place to that place. You can move your body or not by walking, or else by sitting and standing up. Okay, mobility means changing your position from this place to that place. That one is known as mobility. Okay, these bones they will help you in mobility, means changing your place from here to here. Okay, moving from here to there, and in conjunction with muscle. Conjunction with muscles means what? Just beneath your skin, you are having muscles, isn't it? So these bones they helps in what to say? They help the muscle to keep in place, to be in place. That one is known as conjunction. Understand? So are you clear with second point? These bones they helps in uh, producing blood cells. Okay, they store minerals also, and they help in mobility. Mobility means changing your place from this place to that place. Okay, that one is known as mobility. Did you understand second point? Bones. Did you understand? Did you understand or not? Please response.
Yes, sir. Yes, ma'am.
Okay. Okay. Next is bone is made up of bone tissue. Okay. This about tissue we will study in physiology class. Okay, I'll explain to you in physiology class. But for now, you just remember bone is made up of bone tissue, and this tissue is a dense connective tissue. Okay, it is a connective tissue. This connective tissue is one type of tissue. Okay, I'll explain to you in physiology class this tissue. Okay, first is what? First, the bones, what do they do? They support and protect the body. They will support and they will protect the body. Understand? And second is they will produce blood cells, they will store minerals, and they will help you in mobility. Mobility means what? Moving from here to there. And in conjunction with muscle means what? Means the muscle which you have in your body, they helps in sticking in the place. Okay. And the last is this bone is made up of bone tissue. This bone tissue is it comes under this bone tissue is a type of dense connective tissue. This bone is made up of bone tissue and this tissue is a dense connective tissue. Okay. Okay, are you clear?
Yes, ma'am.
Okay. The next, let's move to the next
Yes,
one.
ma'am.
Okay. In these bones, you will get different types of bones. Okay. The first one is the first one is long bones. The second one is short bones. The third one is flat bones. The next is the next is sesamoid bones, and the last is irregular bones. Okay, remember that one. Bones you can find into different types of bones. The first one is long bones, short bones, flat bones, sesamoid bones, and the last is irregular bones. Okay. Okay. In the next slide, I will explain to you long bones. What is long bone? And I will explain everything actually. I'll explain like everything. Long bones, where you will get long bones, where you will find short bones, where you will find flat bones, where you will find sesamoid bones, where you will find irregular bones. I'll explain to you in the next slide. So are you clear with the names of the bones?
Yes, ma'am.
Okay. Next is this. So these are the different types of bones. Okay, first you see flat bones. This is a flat bone. Okay. Okay, this is a flat bone. Where you will find this flat bone in your frontal, means here. You can see me. Can you see me? Here. Yeah, this part.
Ma'am.
This part you will find flat bones. Oh, frontal. This bone is known as frontal. This part is known as frontal. Understand? So this is the front flat bone. Next is the short bone. Short bone. Where you will find short bones in your carpals. This area. This area. Okay, your wrist part. Your wrist. I'm watching. Watch the yeah. The place where you where your okay the place where you wear your bands and all that. Here you will find your carpals. Okay, did you understand?
Yes, ma'am.
Okay, here you will find short bones. Okay, next is sesamoid bone. Okay, sesamoid bone where you will get patella. This is your patella, your knee joint. Okay, this is your knee. Okay, here you will find knee joint or knee gap, you can say. So here is your sesamoid bone. Understand? Next is your irregular bone. Irregular bone where you will find in your vertebra. Vertebra. This is your vertebra. Vertebra where you will get backbone. Your back, no? Your back, the bone, that line is there, isn't it? Or else you can say spine also. So this long bone, this irregular bone you will find here vertebra. So this is your vertebra. There, I'm just zooming out, or zooming in. I mean, I'm just zooming in. So this is your vertebra. So this is your irregular bone. Understand? And last is your long bone. Long bone where you will find in your femur, this area, thigh. In your thigh side, no thigh.
Yes,
So
ma'am.
here you will get your long bone. This is different one. Don't get confused. Sutural bones. Sutural bones. You will study in this one nervous system. I'll explain to you about the structural bones in the nervous system. For now, you just know flat bone, short bone, sesamoid bone, irregular bones, and long bones. Understand? Okay, are you clear?
Yes, ma'am.
Do you want me to repeat again?
No, ma'am.
Huh?
No.
No. Okay. Okay. So now let's see long bones. This long bones has two parts. Okay, diaphysis and epiphysis. Let me show you. This is the diaphysis. Don't see all this part. Okay, all this above portion. Don't see. See this below portion. The long bones has two parts. Okay, epiphysis. No, you don't need to draw it. Okay, in your student portal, you will find it. But if you are willing to draw, if you want to, if you want to draw, it's okay, no problem. Okay, this long bones is divided into two parts. It is epiphysis. Epiphysis where you will get this corner side, both sides, corner side, epiphysis, and diaphysis. Diaphysis you will get in the middle part. So this part is known as diaphysis. Epiphysis is this part, both the ending part. You can say this ending. Suppose this is a long bone. I'm just showing you. This is a long bone. These two parts, ending part is the epiphysis and the middle part is known as the diaphysis. Okay, long bones has two parts, epiphysis and diaphysis. Are you clear? Are you clear?
Yes.
Yes, ma'am.
So where you will find long bones? All these names now I'll explain to you in the next class. Okay. Where you will find long bones? You will find long bones in your legs. There is femur, tibia, fibula. Okay, I'll explain to you one by one. For now, you just know the name now. And in arms also you will get in your arms. Okay, arms. That is the humerus, radius, ulna. You'll get long bones. And next is clavicle. Clavicles or collarbone. Clavicle means this. Okay, this bone. Uh, for girls, mostly we know them as beauty bone, collar bone, collar. Okay, so this here you will find long bones, and last you will find metatarsals and phalanges. Okay, in all this area you will find long bones. All these names, humerus, radius, femur you have already got it, I told you. Tibia, fibula, all this I will explain to you in the next class. For now, you just know that the long bone has two parts, it is diaphysis and epiphysis. Okay, and on all this area, you will be getting long bones. Okay, shall we move to the next slide? Are you clear?
Yes, ma'am.
Okay, now short bones. Okay, short bones where you will get these short bones are just like a box. Okay, their appearance is like a box. And the examples where you will get your short bones in your carpals, it is in your wrist, is this part, Okay, this part you will be getting your carpal bones and tarsal bones. Tarsal bones where you find your ankle. In your ankle area, you will be getting tarsal bones. All these carpal, tarsals, I will explain to you in the next class. For now, you just know the names. Short bones, they look like a box. This carpal, they look like a box. And examples are carpal bones and tarsal bones. Okay, shall we move to the next slide? Are you clear?
Yes, ma'am.
Okay. Okay, next is flat bones. So flat bones, what we will see, they are thin. Okay, they are thin and they are flat. From the name itself, it is they are thin and they are flat, and they appear to be curved, with curving shape. Okay, this part no need. This last part no need. You just remember that these flat bones they are thin and they are flat, and they appear to be mostly curved. And where you will find this flat bone? Sternum. This is your sternum. Okay, this is your ribs, isn't it? So in between your ribs, you will be getting sternum. See, this part is known as sternum. You will get in your chest area. So this part is sternum. So this sternum is known as flat bone. Okay. Okay, shall we move to the next slide? We are done with long bones, then short bones, now flat bones. Shall we move to the next slide?
Yes, ma'am.
Okay, next is sesamoid bones. Sesamoid bones. So these sesamoid bones, how do they look like? They are usually small, okay, small, they are round and they are flat. Small, round and flat. And where do we get mostly this platida? You'll get in your knee joint. Okay, knee, this is your knee, then the hands and the feet. You will get in this area. You note down only that one. Like someone bones, you will get in your platilla, that is in your knee joint. Okay. And they are usually round, small and flat. So that is all about sesamoid. Okay, let's move to the next slide. Are you clear now?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, next is irregular bones. So irregular bones don't fit into the previous category. Previous category means what? All those bones whichever we have discussed now, sesamoid bones, long bones, short bones, they don't means they are totally different. They don't fit in that category. Okay, they are totally different. These irregular bones. So, what is their shape? How do they look like irregular bones? They are complicated shapes. Okay, they are complicated in shape. It's different from the previous bones which you have studied. And the examples means where you will find irregular bones near hip bones means here and in your vertebra means this part. This is your vertebra. So in these two areas you will be getting the irregular bones. Okay. Okay, are you clear? Are you clear with it?
Yes, ma'am.
Shall we repeat again?
No, ma'am.
No,
No.
ma'am.
Okay, if you are clear, then let me ask you now. If you are not clear, I'll explain to you. If you are, I will ask you one by one. Are you ready?
So,
Hmm.
I have a question.
Yeah, yeah, say.
Uh, in that kneecap or sesamoid bone,
Hmm.
what if a small piece of if it is broken, will it be able to means it will create any problem? Means I don't know how to I say like
Means mostly we see this knee joint, na? Knee joint, this
yeah, yeah,
patella. You are talking about this patella only, na? Mostly we
yeah.
see in athlete people. Athlete means sports person, you can say, because they
I
used to.
mean that's my question. What if a small piece of that is broken, and if
Oh,
doctor said we can't able to take it out,
they will have to do
and we,
surgery.
that's exactly what's happening with me now.
Is it? Oh,
Yeah,
okay, we'll have
I
to do surgery. Means there is one, what to say. kneecap, you can say.
Yeah,
Huh? There is one
yeah,
for supporting it. There is one, so to say, just like a belt type, not exactly belt, because
yeah,
for a person who is doing surgery and all that, they used to
yeah.
wear this one or not some belt type. So in the same way, for the knee, like there is one kneecap type. Means what to say,
Yep.
just like a
Yeah, man.
band, just like a band.
Yeah,
In this
yeah.
way.
Means like I went to doctor and he said that we can't operate it if you take out like you can't walk or something. He said to me like that.
But for that, I think you will require that one. That for supporting system, no, you'll have to have that just like a
I
band,
have,
no? What you
I
have?
have that. Yes, yes, I
Oh,
have.
okay. Okay. Does it help you?
It helped, but can't walk properly.
Can't walk properly. Okay, actually, what happened to you?
I play football and it broke my.
You are
It
not
broke.
careful enough. I think that's why. Now, it mostly happened to athlete people only. All this, no? All these
Yeah,
injuries, mostly in the knee.
just a small piece. It broke.
Small piece.
Yeah, piece like can't take out it. Can't be taken out.
Actually, what means you fell down or what?
No, yeah, I was playing football. Then the opponent side he hit me directly on my knee.
That's why. Okay.
It's
When it
it's
happened? Means last year
it's a
or
little long.
long
Uh, not so long.
in which
I can't
year?
remember exactly. I
In which
think
year?
last year, not so last, like December or January, maybe like so.
Okay. Okay, but as far as I know, like you need to have that one, and if possible, you go to doctor like uh, orthopedics, no? Orthopedics. Did
Yeah,
you went or not orthopedics department?
I don't know, man.
Okay, you have to visit all those people, orthopedics. Okay,
Oh, yeah.
they will be able to handle it.
Oh,
Okay.
okay, man.
Uh-huh. Okay, then are you all clear about today's class, students? Please respond when I am questioning
Yes, ma'am. Yes,
students.
ma'am. Yes, ma'am.
Okay,
Ma'am,
Manoj, uh-huh.
ma'am, this part
Jyotishmita Devi, yes, you are saying something.
and tendons, where it is sitting.
Uh-huh.
Tendon.
Tendons. Tendons, I will explain to you in the next class. For now, you just know the bones. Okay, tendons are this one. I'll explain to you in the next class. Okay, for now, you just know the bones.
Okay, ma'am.
Means whatever bones I have discussed. For now, you just focus on that. I'll explain to you like one by one. Are you all clear?
Yes,
Yes,
ma'am.
ma'am.
Okay.
Ma'am.
Okay. R R slick or what? R slick R malak. Okay. R slick R malak. Can you tell me? Can you hear me? R slick R malak.
Yes, ma'am.
Okay. Can you tell me the name of the bones? Huh? Are you clear or not?
Are you clear or not?
Okay, Himanshu.
Okay, Himanshu.
Himanshu, can you hear me?
Himanshu, can you hear me?
Himanshu?
Himanshu?
Himanshu, can you hear me or not?
Himanshu, can you hear me or not?
Ah,
Ah,
Himanshu, na?
Himanshu, na?
Okay, Jeet Bahadur.
Okay, Jeet Bahadur Chitri.
Ma'am.
Okay, can you tell me the types
Okay,
of
can you
bones?
tell me the types of bones?
Sesamoid bone.
Sesamoid bone.
What?
Uh-huh.
Uh-huh.
Irregular bone.
Irregular bone.
हाँ,
Ah,
Uh,
sesamoid bone.
sesamoid bone.
sesamoid bone.
Sesamoid.
Then,
Then,
okay, okay, at least
okay,
you have
okay,
said.
at least we have said.
Okay, next,
Okay,
John,
next,
John Luikham.
John Wickham.
Can you hear me?
Can you hear me?
Yes.
Okay, continue.
Okay, continue.
He said, Rizjeet
Uh,
He
Bahadur,
said,
he said,
Rizjeet Bahadur, he said,
sesamoid bones and
sesamoid bones and
irregular bones.
uh,
irregular bones.
sesamoid bone, irregular bone, flat
हाँ,
bone,
हाँ,
long bone,
हाँ.
and
Okay,
short bone.
okay, okay. Kasturi,
Okay, Kasturi.
Kasturi, can you hear me?
Kasturi, can you hear me?
Kasturi Bhagwati. Yes, Kasturi Bhagwati, can you hear me?
Yes, ma'am. Yes, ma'am.
Okay.
Yes,
Long
ma'am, yes,
bones
ma'am.
is divided into two
Long
parts.
bones is divided into two parts.
Can you name them?
Can you name them?
Can you name them,
Can
Kasturi?
you name them, Kasturi?
Kasturi,
Kasturi.
please see this.
This is,
You see, this is a long bone. It is divided into two
you see,
parts.
this is a
This
long bone.
is
It is divided into two parts.
this is epiphysis, the ending
This is
part.
epiphysis, the ending part.
Okay, both sides you will get epiphysis.
Okay,
And
both
in the
sides you
middle
will get
part, you will get the
epiphysis. And in the
diaphysis.
middle part, you will get the diaphysis.
Okay, are you clear now, Kasturi? Are you clear? Clear now? and I forgot to mention.
And I forgot to mention.
Oops. This femur, no, this long bone,
This femur,
femur,
this
it is the longest
femur,
bone.
it is the longest bone.
Okay, in the human body, it is the
Okay, in the
longest bone,
human body, it is the longest bone.
and it is the strongest also. Longest and the
Strongest
strongest
also.
bone.
Longest and the strongest bone.
Okay,
Okay.
are you clear, everyone?
Are you clear, everyone?
Today's
Yes,
class.
ma'am.
Today's class.
Yes, ma'am.
Okay,
Okay.
okay. Uh,
Okay.